Coming up in today's video, guys, we've got one patient in this whole video, and it is just me.
It's just
and we've also got another question corner for you at the end.
comment corner.
Question corner?
It'll
comment
be
corner?
We're quite fluid with the
comment,
name.
question, whatever.
I tell you what, Kev, you think with the end, because I
Give us a name.
comment corner, and it might work better with a different name. By all means, pop them in the comments.
I was just straight off the tongue, that was.
It was. I did question, I did think about question corner.
Well, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates.
My name is Rhys Brown. I'm the other audiologist at Audiology Associates.
No, that's all right. So yeah, we've got this patient has come to see myself, feeling very, very blocked up, and you can see why. We've got this big dent going right through the front of this, so very similar to the patient you had on your video. Just
with the cotton bud impaction. Yes.
But just not quite as deep. I mean, it might be that deep, but it's potentially just more wax. So I've got the right hook here, and I'm trying to draw it off the ear canal. I'm trying to get some form of detachment. But we've got this little gap you can see here. Now this is what I'm aiming for. I'm gonna try and get this in and see how loose I can get, or see how much movement there is from this wax. Which there's not a great deal.
It really is.
It's not much.
Oh, I don't know. It's starting to move.
Yeah, it's that brittle kind of. You can see. Look at it. It's all falling apart. It's just like layers and layers and layers of dry skin on top of each other.
Collection of crumbly flakes. Yeah, that's what's going on.
I remember this one now. I think this is what I done yesterday as well.
It is, yeah. I think the other is exactly the same as this one as well. Yeah, it was a bit of a beastie.
Yeah, so we're working our way slowly. The reason I haven't used the microsuction is just because it really is not going to work with this at the moment. I mean, it might start working now that I've started to break it up a little bit, but
because it's those things, isn't it? Those flakes.
Yeah.
You'll grip a flake, you'll take a flake out. You'll grip a flake, you take a flake. You won't pull the whole
back
thing.
And forth. Yeah.
Sorry, I talked over you.
No. You don't need to do. I don't think you did. So again, a little tiny gap there. You got to try your best to try and avoid sort of touching and pressing into the ear canal as well.
Yeah.
This is deep.
It goes a fair way back, doesn't it?
Yeah.
It goes a fair way back. It's hard because you're going to draw across the front of this.
Yeah.
And unless you're really lucky, you can just get enough angle to scoop the bottom layer forward. But there's so much attached to that canal wall. I don't even know if you're going to get that,
No, I've got a little bit of pressure on here now. It's gonna, I'm just brushing the surface basically. This, bit of a tricky appointment, to be honest. The wax removal in general was quite difficult. So just taking away these little bits like we just mentioned, so taking away some of these smaller bits just to give myself a little bit more room. And to also see if there is any more movement. Now there's a bit more space in the ear canal. If I can start to peel this away, I might be able to get a bit more kind of peeling through the ear canal. So I may be able to use a little bit of oil. I can't remember if I do, but looking at this, I probably do at some point.
It's where that skin turns into almost like fly paper. Do you remember fly paper?
Is that the kind of
like
sticky kind of,
yeah. It goes like that, so everything sticks to it, and then that sticks to the canal wall. So that first layer of skin, if you can get a good peel there, which is exactly what this is why it didn't come forwards with Rai Curette, isn't it? Oh, that's a beast.
There we are.
That's a lot of peeling, that is.
Like I said, if this doesn't go anywhere now, normally you can pop a little bit of oil in and that should make it slide out a little bit easier. But I've got a good grip with the suction, which is why I'm not really using any at the moment. So I've kind of broken a bit away there, got a big chunk away.
You had to do that as well, because when you're lifting, you run out of space, because obviously you're lifting from one canal to opposing canal wall. So when you're lifting up, you run out of room, don't you? So you have to shear and then go in and lift the next piece up. Yep.
So I think if this was a little bit kind of softer, this probably would have come away a lot easier.
Yeah.
But generally, we've mentioned it, a few times. We get, quite a lot of patients who are a little bit kind of dubious about using any oil. They don't really want to you know, put any in, because if the hearing is already pretty, you know, pretty bad, it just makes it worse, because the wax will try and absorb the oil that you've put in, which, you know, it kind of gets worse for it to get better, because it does make it easier for us to remove. But yeah, we do get some patients that don't like using it, which is fair enough. You know, we can't make anybody do anything.
You're doing. I can see what you've done. You've unstuck the bottom now. You're working your way up the right hand side to unstick those bits. But I think you've hit a bit of a stumbling block with this net. This little flap skin, isn't it? It's not long enough you can get a good grip on, but it's just long enough that it gets in the way of everything you're trying to do.
Oh, there we go. That's
nice
away.
Nice chunk.
I've got an incredibly itchy nose. I keep scratching it all the time. Sorry.
What's going on?
I'm not gonna. I won't sneeze. It's fine. You're okay.
Go on.
I don't know. I think it's my hairs. they're all. I guess they're all tangled up.
No, you plapped them.
Yeah.
Look at this. You could see just how dry that layer is now on the canal. Why everything was sticking to this.
Yeah.
This patient needs some oil in their life, don't they? They really need to be using oil on a regular basis.
Dry as a bone.
It is dry as a bone, yeah. Gosh.
It's a weird consistency as well, because even though it's dry, it's got that weird kind of like, no, I wouldn't say stickiness, but it's like stretch almost.
Yeah. It's like a flaky, almost keratin, isn't it? It's a real funny old one.
Now these are the noisy bits.
Yeah.
These are usually quite difficult to remove. You can't hear it or see it on the video, but sometimes these little thin bits that you're seeing me trying to take away here now, they tend to clarinet, they whistle quite a lot. So I may not be able to get this away cleanly, because I obviously got to keep the patient as comfortable as possible.
Yeah, would have clarineted.
It already was, which is why we've kind of stopped.
God. So just out of curiosity then, looking at the central depression in this wax, has this patient been using cotton buds as well?
No, so this was a hearing aid wearer. Okay. So yeah, it's not cotton buds. So the patient's family actually got the patient over because they were getting fed up with the whistling basically coming from the hearing aids. Right. So what you tend to find a lot of the time with a blockage of wax, especially if you're wearing hearing aids, one of the symptoms that the wax is building up is a bit of pressure. Sometimes you can get pressure as you're putting the hearing aid in. Yeah. It can block your hearing aid up quite quickly. So if you're constantly having to clean your hearing aids or change filters, could be a sign the wax is building up, and a lot of feedback. You can get a lot of whistling coming from the hearing aids. And if you are a hearing aid wearer yourself and you've got quite a severe high frequency hearing loss, you actually may not be able to hear that whistling yourself. Right. So, you may get some of your family members mentioning to you when the hearing aid is in, oh, your hearing aid is whistling quite a lot. So yeah, just get your ears checked, and it could be wax.
But this is coming away a little bit easier than the other side. There's a bit more substance to this wax, isn't it?
And it would probably make sense as to why the patient doesn't want to use any oil as well, because I mean that could make the hearing aid worse as well. It could make the sound of the hearing aid worse. Yeah. But yeah, so far so good. Just getting all these little bits away. You can see all these crumbly little tiny bits now that are left here.
Suction is sometimes helpful for this kind of thing, isn't it? Where you've got these little tiny bits.
There was a little patch at the bottom here. It was absolutely solid. I couldn't peel it away.
It's that thicker kind of skin, isn't it?
Yeah, this bit by here, I was literally just dragging over the surface. I could not get it peeling. So I do go forwards and get that deeper section in a second.
Don't forget, guys, if you do enjoy the videos, you can also, if you wouldn't mind liking, like, heart, share, follow, and subscribe for us. That would be absolutely fantastic. It does push the video out to more people, and that's always really helpful for us. So thank you if you don't mind doing that. If you thoroughly enjoy the videos, you can also consider becoming members of the channel. You get 2 more videos every single week of wax removals that nobody else gets to see. So you guys get to see them as members. So thank you very much for that, and make sure you stay tuned for your comment corner. It might be your comment that's going to pop up on the screen next.
Drum roll.
This is where it gets fiddly. You've got lots of little bits in here. Sometimes I'll put some oil in with this, but not always.
No, I can't. I think this might be the patient's first visit with us.
Oh, is it?
I think. off the top of my head. They definitely don't have hearing aids with us anyway. I think patient might have NHS hearing aids. And I believe he went to one of his assessments or checkups, and he was told then that, you know, there was a bit of a build up there. But a lot of NHS appointments are not doing wax removal at the moment, which is a little bit awkward for some patients, because they're going to have to like rearrange the appointment, come to us to have it removed, and
so I'm surprised the amount of obviously we're a private audiology company, but I'm surprised the amount of private audiology companies that don't do wax removal.
When I was in university, they were considering adding it as part of the course, but I'm not sure if that has changed. But
I know the degree they did, or I know, because I know the guy that runs the degree in Swansea in Wales. They do it there, and they've got a specialist suite where they do it. But it's the amount of other companies that send patients to us. You know, you'd think, well, if you're looking after somebody's hearing aids,
that little bit was just absolutely solid. I cannot get that moving.
Yeah.
I did try my best. I mean, I probably could have gone in there with a manual tool, but I didn't want to make this uncomfortable for the patient. You're going to have to press into the ear canal to get that loose. So what's that, just short of 5 centimetres there.
2 inches
I haven't got my glasses on.
Do you want me to read it out to you?
So we got K. Hughes, 1963. You are very detailed and educated. And educate us on a lot. Could you please have Katie do some commentary on the videos along with the both of you? She's a real pro now with your joint instruction.
So Kate. In fairness, Katie's coming on leaps and bounds. She's doing really, really well at the wax removal side of things. We would love to have Katie back on the screen, but Katie is very, very camera shy, and Katie, it really doesn't want to come back on the screen, guys, unfortunately. I have asked again recently because she's gained her confidence a bit more, but she's really not fussed. So we're not holding her back off the screen. This is Katie's decision not to come back on. She's really happy doing the wax removal, but not so comfortable. Not as comfortable when you were doing this kind of.
I know she didn't seem like it on the videos when you was watching her, but she like dreaded it, didn't she? Every time you're like, oh, this is every time like, all right, come on, we're going to do some videos, and I'm just like, oh, she's like, and I was like that when I first started, to be fair. I mean, I haven't even looked back at my first video. It's probably horrendous, to be fair, but it's not an easy thing to do. I know there's only one little camera here, but you know, there's potentially, you know, thousands and thousands and thousands of people going to be watching this. So so it's a little bit nerve-wracking.
It is a bit nerve-wracking. Well, guys, lots of people have asked the same thing, and this is so this is why I wanted to put this one in comment corner, just because it had come up so much, and obviously you guys need some transparency. I think you thought we'd kind of put her in a box somewhere and left her there. But basically, she just doesn't want to come back. So that's that, guys. But it'll just be me and Taylor moving forwards again. So no Katie, unfortunately, but she will still be supplying you with videos to watch as well. Well, guys, thank you so much for getting to the end of the video, and thank you very much, K Hughes 1963, for your comment as well, which was displayed. Don't forget, guys, if you want your comment up here for us to talk about, make sure you put it in the comment section, so at least we can know you're asking the questions, and we'll pick one randomly from there. That's what I'm trying to say. But until next time, guys, as always, take care of yourselves.
Take care of your ears.
And take care of one another. And myself and lovely Miss Taylor Green. We'll see you for the next video. Bye, everybody.
Bye-bye.